Hello, everybody, and welcome to my new live. Today, we're going to talk about nociceptive pain, and um, this is something I will do really shortly because yesterday I talked about it way more than I actually wanted to, and it was around 20 minutes. So today we can hold it pretty shortly. But for everybody who doesn't know me yet, I'm Gideon. I'm a psychologist. I'm a licensed psychotherapist in Germany, specialized on the treatment of pain. And in 2021, I was awarded with the German Pain Award for science and pain medicine, which I'm definitely proud of. So, oh yeah, and not to forget, I'm a pain patient myself. So I know both sides and I try to give you information that I think can be valuable for you, or at least you can pick out the information that might be valuable for you to start a good journey through the pain and maybe even find a way out. Okay. I hear more and more about the healing of pain and especially of chronic pain. But there's a reason why it's called chronic, isn't it? Because it doesn't just go away so easily. And recovery, I think, is absolutely possible. But healing, in some cases, yes, definitely. But not for everybody. And I'm one of those people on the sides, not for everybody. Because what I took out of a car crash um, is just with some arthritis, with crooked bones because they didn't heal that well, and all this. So actually, it's going to hurt again and again and again. But nevertheless, everything I tell you, you can use hopefully to find a good way in dealing with the pain. This I know is possible for nearly everybody. And I treated hundreds of clients. And so I know what is possible and what not. And sometimes the pain vanishes at all. But every time, and hear my warning, every time somebody tells you, oh, we're going to get rid of the pain, be very wary. Okay? So much up front. Okay, now we dive into something that's some basic understanding of the kinds of pain, because pain is something we can categorize pretty well, where it stems from and what its effects are. And the most common pain is nociceptive pain. Why is it so important to understand this? Well, I already talked about the journey, but the other part is to understand why your doctor, the therapists, anybody in the health system is doing special things with you. Because for nociceptive pain, you need a different treatment than for neuropathic pain or for nociplastic pain. And sometimes these three mix up together. But here I want to make a clear distinction between those. Okay, so it's a better understanding of the treatment that's happening to you. I know from myself and a lot of patients that if you go to the doctor, they will maybe tell you something. Often it's packed into some Latin words, and they prescribe you something that you should take, and nobody tells you what it actually does or why they prescribe it. So it's good to get some background and to know your way around yourself, especially because the pain might be chronic. The nociception is something very peculiar in our body. Our body is on the inside covered with a lot of fibers, a lot of nerves that just sense changes in pressure, changes in um, if it's hot, if it's cold, in temperature. That was the word. And also, it's discovering changes that are chemical. Like when inflammation is going on. And this is very, very important because by these fibers can report sudden and strong changes or growing changes to our brain, and our brain can decide if this is worth of turning the alarm system on, meaning that pain will go through the system and all what's covered with pain will be active. So these nociceptors, they're everywhere in the skin, and they're just a few, really a few parts of the body where there are no nociceptors, like the brain itself. That's why there can be surgery on the open brain, and people are awake during this time. Nociceptors, they make sure that we don't die, basically, that we don't do anything that's worse. Like when we cut ourselves, when we break our bones, and often it is the skin that covers the bone itself, that's ruptured. And then it starts to hurt really badly because the nociceptors, they'll say, oh, something wrong, something wrong, something wrong. So they are the guards in our body, in the extremities, like the arms, the legs, like our belly. And extremities means everything that's not in the central nervous system. And by this, it's a really, really important part, when they discover a sudden change, when we hit something, and we flinch back. That's exactly what their job is, to keep us safe. And afterwards we go like, ouch. And I guess you experienced things like that before. Okay. One very, very important part of what we call nociceptive pain is that inflammation plays a crucial role in there. And that's why we take medication like ibuprofen, or sometimes you might have gotten an injection of cortisol by your doctor. All this is to keep the inflammation down. And by this, often the pain goes down. So this is a typical way of treating nociceptive pain. When nociceptive pain is getting chronic, the nociceptors, they get more and more sensitive. We call it a sensitization. And along with it goes something like a chronic sleep system, and by this, these fibers, these nociceptors, are easily provoked, and they react earlier. So they react to smaller stimuli. That's what's happening in, in chronic pain when it's nociceptive pain. Now, I'm not talking about all the changes that go on in your central nervous system. It's just about the nociceptors now, what I'm saying. There's more happening, of course. So we get medication to come down. We do things like cooling, okay, to get these fibers, the nociceptors, to calm down, to get the inflammation to calm down. Sometimes it's by getting the blood flow going. If the muscles are tightened up real badly, and they say, oh, something's wrong here, and they secrete some stuff that's provoking a slight inflammation, and by this provoking the nociceptors, and suddenly this muscle that's tensed up starts to hurt. And that's a way of telling the brain, hey, something's wrong down here. And maybe you discovered when you put something warm or hot on it, if you do a relaxation, if you take a warm bath or something like this, this can help to loosen up the muscle so the blood flow will go through it and the inflammation isn't necessary anymore. So I talk about inflammation as if it's a bad thing. Inflammation is very, very important to keep our body alive. If there's something going on, if there's something inside that shouldn't be there, or if something's going on that shouldn't go on that way, and our body, our immune system reacts, and by this telling our brain, hey, this part here needs attention. So inflammation isn't bad at all. But like other things like stress and other things, if it's getting chronic, it's getting bad. Okay? When I have a chronic inflammation, that's not good. If I have a chronic stress, that's not good. If I have chronic high blood pressure, that's not good. If I have blood pressure that goes up and down and up and down, that's what it's for, to adapt to all the situations in our lives. But if it's stuck on a high level, that's not good. And that's for everything. Inflammation can come and go, come and go. When we get a cold, when we got a virus doing stuff in our body, it's good that our immune system reacts. But if this reaction stays, that's not good. So, coming back to the nociceptive pain itself, these are the fibers in our body that give the information to the brain. And that's now the simple way to put it, that something's going wrong. Okay? It's not pain yet. But if there's enough input from these fibers into our spinal cord, then the brain will decide, oh, let's turn the alarm system on. Okay, so much for nociceptive pain. I know that I missed probably such a lot of things that I could tell you that will come to my mind as soon as I stopped here. But I think the most important parts you have. If there's anything that was important for you, that you like to know more about, Please let me know in the comments. And you might even let me know what are the things that help you when you suffer from nociceptive pain. What did you find as a relief for you? Okay, I'm happy to be with you tomorrow again at the same time, talking about neuropathic pain. See you tomorrow. Bye.